And when we are talking about bone health, muscle health, तो ऐसा कुछ अल्ट्रासाउंड या बोन हेल्थ टेस्ट है जो आप सजेस्ट करते हो कि हमेशा मेनोपॉज के टाइम करना चाहिए?
Certainly, DEXA scan for bone density is a very good test.
Okay.
It has two components. One is it checks the bone density for seeing the mineralization of the bone and strongness of the bone, strength of the bone. And second is it gives differential weight.
Okay.
That means how much is your muscle weight, how much is your bone weight, and how much is your fat weight.
Okay.
So it gives a differential weight pattern. Depending on that, we can come to know that where we are lacking. Is the muscle weight less, so she should have more proteins, include more proteins in her diet. That way.
Okay. A lot of times now I am seeing, ma'am, that perimenopause, because also a level of patience is very less now. Earlier there used to be, because woman is working also, there's a lot of stress also, lifestyle ko bhi control karna, it's very difficult because she feels that she can do multitasking. So a lot of times what I see is in their perimenopause age or menopause age, if they feel that it's an early stage or they don't evaluate whether they had periods early in the age, so they opt for HRT, Hormone Replacement Therapy. So I would love that if you can speak about HRT. I know if it is safe if you are taking it under the supervision of your gynecologist.
Yes.
But when should they take it, and are there any possible side effects to it?
Yes. To every medicine there is a side effect. As far as we are using our own hormones, our own body balances everything.
Correct.
Because there is a balancing mechanism inside our body, which is called negative feedback. If the hormone becomes too much, the gland starts reduce production of that hormone and vice versa. But when you are taking external hormones, it becomes very difficult to titrate the hormone as per the need of the body.
Happy and healthy morning, everyone. Welcome back to Aura Health. I would like to thank you all for the amazing support you all provided for Aura Health season number 1. Today we are shooting amazing episode of season number 2 with an amazing personality. I am going to talk more about her in my introduction. But before that, I want to show my immense gratitude for all the love, support you had been showering on this Aura Health. So we are soon going to share a special video with all of you where we are going to talk more about season number 2. It is going to be more exciting. So today we have an amazing personality with us because it is going to be the first episode. I thought why not to speak on a topic which is a very common topic. Every family, every woman in her life goes through this situation. So we have Dr. Dhanashri Joshi here with us, who is a consultant radiologist with 20 years of experience, and she is the director of Dr. Dhanashri Joshi Sonography Center. So let us hear more about her.
I am Dr. Dhanashri Joshi, consultant radiologist with more than 20 years of experience, practicing at Dr. Dhanashri Sonography Clinic, Soham Plaza, Manpada, Ghodbandar Road. I have studied in BJ Medical College, Sassoon Hospital, Pune. After that, I am trained in JJ Hospital, Jaslok Hospital and Jhankare Imaging for 5 to 6 years. After that, I started my own practice at Ghodbandar Road. And all these places, I have got immense and vast experience of various cases and multiple varied experience basically of multiple patients.
Awesome. So ma'am, because you had been dealing with a lot of women patients every day since 20 years now. So when I was thinking about this topic, obviously I wanted to speak to somebody who had been, dealing with females. So what I just thought, why not to have a senior radiologist who might be speaking to a lot of women patients every day and talk about this topic, because a lot of times when I am consulting women patients, they don't even know कि ये कब start हुआ, इसके symptoms क्या है. So we wanted to shoot an episode on this topic. So before talking about anything else, I just want to ask you, what is menopause?
Menopause is absence of periods for a minimum of 1 year. It happens anywhere between 45 and 50 years. Once we have, generally it starts with less frequent periods or less bleeding during periods, And but when the absence of periods completes 1 year, that is when the woman is labeled as menopause.
Okay. और generally ये menopause का age क्या रहता है?
Generally 45 to 50, but it also depends on your heredity, when your mother started or stopped the periods,
Right.
and lifestyle changes. If you have started the periods early, then the periods generally also stop early.
Okay.
That is how.
ओके सो हमने जैसे देखा कि 45 to 55 के एज में मेनोपॉज होता है, तो ऑब्वियसली उससे पहले का भी एक स्टेज होगा या उसके दौरान. व्हाट आर द सिम्टम्स जनरली?
Yeah, that is called perimenopausal age. In that, as I told you, menstrual irregularities start. Either they are too much of bleeding, or there is scanty bleeding, less frequent bleeding, or longer duration without any periods. Along with that, other symptoms like irritability, chirchidapan, then
Mood swings
thakan,
जो बोलते हैं,
mood swings, fatigue, all these things are come along.
Correct.
And feeling tired all the time, and irritability and mood swings are the most common features.
So अभी आपने जैसे बताया कि मेनोपॉज के एज, मेनोपॉज के स्टेज से पहले जो स्टेज आता है उसको पेरीमेनोपॉज बोलते हैं.
Right.
तो जनरली पेरीमेनोपॉज कितने टाइम तक चलता है या वो मेनोपॉज से कितना पहले स्टार्ट होता है?
Perimenopause is a broader term which includes pre, post, and actual menopause.
Okay.
So it generally goes for around 2 to 3 years, but sometimes it stretches up to 5 years as well.
Okay.
And some of the symptoms like hot flushes and mood swings and night sweats, these also may persist way beyond that.
सो मैम आजकल आपने देखा होगा कि जब हम लोग इतने वुमेन पेशेंट्स को देखते हैं तो लाइफस्टाइल की वजह से, स्ट्रेस की वजह से हार्मोनल इम्बैलेंस भी बहुत ज्यादा है, राइट? बट आपको कैसे पता चलता है कि ये पर्टिकुलर सिचुएशन जो है वो हार्मोनल इम्बैलेंस है या पेरीमेनोपॉज है, या ये सिचुएशन में मुझे एक मेडिकल इंटरवेंशन की जरूरत है?
हाँ, तो द टिपिकल सिम्टम्स दैट आई टोल्ड यू, लाइक नाइट स्वेट्स, hot flushes, irritability, and mood swings. All these things generally are associated with perimenopausal age.
Okay.
But if there is heavy bleeding, or hemoglobin dropping down to 5, 6 and all because of the heavy bleeding, then if the patient was not so much irritable before and she has suddenly become very irritable, which is uncontrollable, in such situations the patient needs medical help. Sometimes meet a gynec, or sometimes they need counseling from a psychotherapist as well.
ओके. सो जनरली बॉडी में ऐसा क्या चेंज होता है या हार्मोनल क्या चेंज होता है कि मेनोपॉज स्टेज आता है? और जो हार्मोनल चेंज होता है उस पे बॉडी पे इम्पैक्ट क्या है?
Now, menopause is basically stopping or drying out of female hormones, FSH and LH. They have their own functions, like keeping the bone health good, muscle tone, and skin tone. So the hormones have their own effects. So once that hormones dry out, the target organs start showing the effects, like there is muscle laxity, bone density reduces, and skin starts getting wrinkles, and mood swings, as I told you. Also there is deficiency of happy hormones like serotonin, endorphins. Also, the most important thing apart from hormones in this period is that the children grow up, and they leave home for education or for the job. And till then, the woman's life is around the children.
Correct.
So once they leave the house and go, emptiness fills up. It's called empty nest syndrome.
Okay.
So once the chicks fly out, the nest is empty. Same way, once the children are away, the woman is all alone sitting at home, not understanding what to do with the sudden time she has got.
Correct.
And nobody to care for. It has become her mind has got conditioned like that, to worry for children, to give them time and as per
Maybe a
their
lot of
timing.
emotional dependency is also there.
Emotional, and her timetable has become all around them.
Yeah.
So once they leave the house and go, she doesn't know what to do with the time suddenly she has nothing to do.
Correct.
An empty mind is devil's workshop.
Yeah.
So she just keep thinking, worrying, and on the top of that, all this menopause thing comes.
Yeah.
The husband is unable to understand what is going on.
True.
She herself is unable to explain what
Yeah.
exactly is happening to her.
Yeah.
The non-medico
Yes,
people,
because so she is also going through a lot of changes at the
Changes.
same time.
and
So it takes time to understand.
and
Yeah.
she herself doesn't understand what is going on. So she is unable to explain,
Yeah.
and then nobody understands her situation, and
Correct.
nobody is able to help her.
Yeah. So there is a lack of emotional support there.
Absolutely.
One thing what I have seen a lot of times when I am dealing with perimenopause or menopause patients, so there is a drastic change in their bone health.
Yes.
Maybe I can say early osteoporosis or sarcopenia, but अगर आप नहीं देखोगे तो muscle loss है, जो bone health है वो बहुत disturb हो जाता है.
True.
तो उसका क्या reason है menopause में और उसको cope up कैसे कर सकते हैं?
या बोन हेल्थ पे बहुत गहरा असर पड़ता है, क्योंकि इस्ट्रोजन एंड प्रोजेस्टेरॉन दे हेल्प इन बिल्डिंग अप बोन्स. Other hormones also are there, like parathormone, thyroid hormones, which help in depositing the calcium in the blood into the bone.
Okay.
That way making the bone stronger.
Right.
Along with many of the times, along with the hormones that we are speaking about, estrogen and progesterone, there are other hormones also like thyroid, parathyroid, which are also deranged. Overall, and thyroid is many patients are suffering from hypothyroidism. They don't even know because they never check.
Yeah.
So thyroid is a vital hormone which keeps our system going,
Yeah.
It maintains the basic metabolism rate.
Correct.
And the basic metabolism overall.
Right.
So it all gets disturbed, and then it affects the bone health.
Correct.
Also at that time, the women, Indian women especially, are known to neglect themselves.
Yeah.
खाना खाएंगे तो पहले सब लोग खा ले, फिर बचा तो मैं खाऊंगी, और अपने खुद के लिए अपना जो फेवरेट डिश है वो बना के कभी नहीं खाएंगे. कभी अगर सबका खाना हो गया, आधी रोटी बची है तो जाने दो, मैं इतना ही खा लेती हूँ. ऑल दैट. एंड वंस दे आर इन लिटिल डिप्रेशन ऑल्सो आफ्टर चिल्ड्रन गो आउट. खुद के लिए ऐसा 2 ही लोगों के लिए क्या बनाना है, या अकेले अगर खाने वाली हो तो कुछ भी ब्रेड वगैरह खा लेते हैं, कुछ ऐसा बनाते नहीं खुद से. So that also, nutrition wise also, she is deprived.
And when we are talking about bone health, muscle health, तो ऐसा कुछ अल्ट्रासाउंड या बोन हेल्थ टेस्ट है जो आप सजेस्ट करते हो कि हमेशा मेनोपॉज के टाइम करना चाहिए?
Certainly. DEXA scan for bone density is a very good test.
Okay.
It has 2 components. One is it checks the bone density for seeing the mineralization of the bone and strongness of the bone, strength of the bone.
Yeah.
And second is it gives differential weight.
Okay.
That means how much is your muscle weight, how much is your bone weight, and how much is your fat weight.
Okay.
So it gives a differential weight pattern. Depending on that, we can come to know that where we are lacking. Is the muscle weight less, so she should have more proteins, include more proteins,
right,
in her diet.
Okay.
That way.
Okay. So my next question to you is, after speaking about bone health, generally a lot of times you must have seen the second, important component which we need to speak is their breast health is also affected.
Absolutely.
And a lot of times I have seen that they are not even aware that they need to do screening regularly.
Yes.
So what would you like to tell them about this?
Yes. Breast health also is a part of perimenopausal syndrome. Due to hormonal changes, the breasts become heavy. The woman feels bloated because of water retention. The breasts become painful and heavy. That is how the menopause affects the breasts.
Okay.
And a person must do a regular checkup of the breast. How? One is self breast examination. If you visit your gynec, they will show you, or you can go to net. There it is shown how to self examine the breast. It should be done once a month.
Okay.
And a baseline mammography should be done. Nowadays, there are various theories or difference of opinion about how frequently the mammography should be done, because mammography involves the X-rays,
Yeah.
and they are also not. It's not a very good idea to get exposed to X-rays very frequently.
Okay.
So, what we all suggest is, first, baseline mammography should be done after the age of 40, and after that, every year, a sonomammography, meaning sonography of the breast, should be done, and self breast examination should be done once a month.
Once in a month.
Yeah.
So again, I would also like to ask, other than this breast health, what are the other diseases which you feel that the women are more exposed to? So because there is a, hormone withdrawal is there, bone density is less, muscle loss is there. So what are the risk factors, or what diseases they can, easily get exposed to now?
First of all, after menopause, the women become as vulnerable as men to the heart attacks.
Okay.
Till the age of menopause, they are protected by from the heart attacks by estrogen and progesterone. So they become as vulnerable as men for the heart attacks. And minor fractures, which happen on their own or with a trivial trauma, especially the spine, hip, and feet, they are vulnerable to that.
Okay.
So they just tip and they get a fracture.
Oh, is it?
Because the bones have become very fragile.
Okay.
So they are again more prone to that.
Okay.
Women who are at high risk of breast cancers, what are they? Actually, women who have maternal relative who has had breast cancer, like mother, sister, masi, or mother's mother, nani, they are prone to breast cancer. We call them more at risk for the breast cancers. So they should definitely get a baseline mammo and a sonomammo done. But for them, some doctors suggest that they should do a mammography and sonomammography alternate year. Means this year if they do mammography, next year they have to do sonomammography,
Right.
and again next year mammography.
Right.
That way they are not too much exposed to X-rays also,
Right.
and still they are undergoing mammography.
Right.
That way. And while self-examining breast tissue, if they come across any lump, they should visit a gynec or a radiologist and get their breast examination done. If on sonography, if the breast lump is suspicious, we can go ahead with a biopsy, which can be done in most of the sonography clinics, and that can be sent to the lab, and we get a clear answer to whether that lump is cancerous or non-cancerous.
Okay.
And there is nothing to worry about even if it is cancerous, because very good medicines and very good protocol of treatment is available now, and a person can be cured of cancer.
Right. Correct. A lot of times now I am seeing, ma'am, that perimenopause, because also a level of patience is very less now. Earlier there used to be, because woman is working also, there's a lot of stress also, lifestyle ko bhi control karna, it's very difficult because she feels that she can do multitasking. So a lot of times what I see is in their perimenopause age or menopause age, if they feel that it's an early stage, or they don't evaluate whether they had periods early in the age, so they opt for HRT, Hormone Replacement Therapy. So I would love that if you can speak about HRT. I know if it is safe if you are taking it under the supervision
Absolutely.
of your gynecologist.
Yes.
But when should they take it, and are there any possible side effects to it?
Yes. To every medicine there is a side effect. As far as we are using our own hormones, our own body balances everything.
Correct.
Because there is a balancing mechanism inside our body, which is called negative feedback. If the hormone becomes too much, the gland starts reduce production of that hormone, and vice versa. But when you are taking external hormones, it becomes very difficult to titrate the hormone as per the need of the body.
Right.
So, if at all you are taking HRT, it must be under the supervision of a doctor. And again, there are side effects of the HRT because breast cancers and endometrial cancers and all, the patient is more prone to that.
Right.